My name's Maria, and in this video, I'm gonna talk real slow. Hey guys, and welcome to my channel. My name is Maria, and in this video, I'm going to be sharing tips and advice on how to pass your nursing interview. Some of you guys may have seen a very similar video on this channel. That video was filmed probably about 2-3 years ago, and so much has changed. I'm working as a band 5 registered nurse, and at the time of filming this video, I've been doing so for 18 months. Prior to that, I finished my 4-year undergraduate Master of Nursing degree. That's very similar to a 3-year nursing degree, but rather than finishing after 3 years with a bachelor's, I finished after 4 years with a master's. And here we are right now to do the same video again, but to give you guys different types of advice. Obviously, I've been through the nursing degree process. Obviously, I'm working as a band 5 registered nurse, and I want to give you guys more information. What I said in the previous video is still going to be very relevant. So if you haven't watched it, make sure you check it out. But in this video, I'm going to be introducing a lot of new information, in particular the presentations that a lot of nursing degree interviews are now asking a lot of their candidates to do. So without further ado, let's start this video. Give this video a like, subscribe to my channel, make sure you pay attention to this bit up here, and make sure you pay attention to the comments box, because I don't want to make this video too long. What I'm going to do is, if there's a topic that I've expanded on in great detail in a different video, then I'm going to put it in the comments box below. For example, in this video, we are going to be talking about, we're going to do the easy stuff first. For example, what to wear, travel, equipment. And then we're going to go into the proper nitty-gritty stuff, the stuff that's really going to make sure that you're the best candidate as possible. We're going to talk about the maths and English test, obviously give you guys tips and advice, pointers on that. We're going to be talking about the individual interview, the group interview. We're going to be talking about the simulation, and we're also going to be talking about the presentation. Like I said, if there's any topic that I've explored in more detail, I'll put it up here, and I'll also put it in the comments box below. The first thing that comes to mind is when I think of trick questions. I have a video dedicated just to trick questions. Again, look up here, make sure you look in the comments box below, because chances are I've probably already will do a video about it that will go into greater detail. So like this video, get comfy, like for real, because this video is probably going to be very long. Get comfy, and let's start. Look at my notes, guys. Like, I didn't come to play. People who will subscribe to my channel, whether they've come for advice for newly qualified nurses, advice on how to write an essay, they know I don't play. I come with the practical facts. So subscribe, and yeah, let's start. Oh yeah, I do want to shout out my website, www.nursingpersonalstatement.co.uk. If you need any help with your nursing personal statement, or if you need any help or know anybody who needs any help with a handful of their nursing essays, then direct them to my website. A link will be in the description box below. That is www.nursingpersonalstatement.co.uk. So yeah, like I said, we're going to start with the basics, and then we're going to really go into the nitty-gritty. So the first thing a lot of people ask is, what should I wear to my interview? Again, this is super basic. Just wear smart casual wear, whether that be a black pair of trousers, a black skirt, whether it be a pair of chinos. Just wear smart casual and anything you can stretch in. I say stretching because sometimes in some group interviews or some nursing selection days or interview days, you might have to be doing some not physical exercise, but you might need to be moving a lot. So you don't want a super mini skirt. You don't want, like, for the guys, you don't want like really tight skinny jeans. I say just go for a casual, whether that be like a beige coloured chino, or whether it be like navy blue skinny jeans, or whether it be like straight cut black trousers. And I'd also go for a blouse as well. If you're a guy, I'll go for a casual shirt. So that could be like a linen shirt or like the cotton material. Just go for smart casual. Ladies, even something as simple as this top that I'm wearing would be completely fine, and you could wear it with a pair of straight cut, you know, black jeans, or a pair of straight cut trousers, and wear flat shoes as well. That's what I recommend in terms of what to wear. When I'm giving you guys advice on what to wear, it's not more so that you look professional, which is very important. It's just also in terms of comfortability. It's kind of like when you guys are going out on a night out, what you'd wear on a night out, you won't wear to church. You probably won't wear to school, just because that isn't the best environment for it. Like, yeah, mini skirt on a night out, woo, 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 fun. But if you had to go out as this midday in that same dress, you'd feel uncomfortable. So that's how it is. If you have hair that touches your shoulders or goes beyond your shoulders, I'm not saying tie your hair up, but make sure you have a hairband with you just in case you have to do some sort of physical activity or any activity where your hair might get in the way. You just want to quickly take your hairband off, tie your hair up, and go about and do what you need to do. I did have someone comment on my Instagram or message me or DM me somewhere saying about long nails. Long nails should be fine. I don't really see the issue with it. You know, I'm pretty sure that you understand that if you have super long nails, when you do become a student nurse, you know, during practice, when you do become a resident nurse, there's no way you can have long nails. But yeah, long nails, I don't really see what an issue is with that, just as long as they're not like unprofessional. But what are unprofessional nails, you know? Sometimes it's just part of the culture. In terms of travel, I suggest arranging your travel at least 2 weeks in advance. Whether you have to take a plane, whether you have to take a plane, yeah, because some people legit have to take a plane to get to their interview. Whether you have to take a train, whether it's just a bus journey away, whether it's just a taxi ride away, make sure you plan your journey. No, I probably wouldn't say 2 weeks. I'll probably say at least a month in advance. There is no reason why you should be late for your nursing interview. If you're trying to plan your travel and you realize, oh, actually, I can't get here on time because I have other commitments, call the university and say, hey, I love this university. I know I really, really want to go. I'm really passionate. I'm looking forward to my interview. However, I've got X on this day and I cannot change it. Can I have my interview on this day instead? Because with universities, they don't just have one day to interview people. They have a whole bunch of different days. And I'm pretty sure that they can just take your slot out of Monday and put you in a Tuesday slot or put you in a Monday slot for next week. So yeah, don't be late for your interview. Make sure you arrive on time. And one way you can make sure you arrive on time for your interview is to make sure that you've made the necessary travel arrangements well in advance. Because if you arrive late for your interview, you're basically just putting a sour taste in their mouth. They're thinking, okay, everybody's been able to arrive on time. What was your reason? And unless there was like, I don't know, a fire on a train, or I don't know, maybe the plane was stopped because they ran out of fuel and you can actually prove that this happened, then it's not gonna work in your best interest in terms of being late. During the individual interview, what they're doing is assessing you against a set of criteria. They want to see if your values match the value of the university. They want to see if your values match the values of the hospitals that they're in partnership with. They also want to see, most importantly, if your values match, align, lie parallel to, are similar to nursing values. So you need to know what the 6 C's are, our culture of compassionate care, maybe the 5-year forward view. You need to know what the NMC code is, or at least what the subtitles of the NMC code is. I say blah 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 because it's all very basic information. So give yourself a pat on the back for clicking on this video. Also subscribe to my channel and like this channel, and give yourself another pat on the back because I'm about to share a handful of very important information. Now let's get into the nitty-gritty. I need to stabilize myself for what it is I'm going to tell you. Your individual interview is basically an academic piece of writing. I would compare it to a nursing essay, and it is very similar, or it's basically almost like an extension of your nursing personal statement. For those of you guys who have used my nursing personal statement package, which is available on www.nursingpersonalstatement.co.uk, you'll be very familiar with things like analysis, link of theory to practice, all of that stuff. And in order to ace your nursing interview, or the individual part of it, you basically need to extend this during your interview. And one way you can do this is by using the STAR technique. STAR is basically a method, technique that a lot of people use right up until, like, you know, executives use in order to answer certain types of questions. And STAR is an acronym, and it basically stands for situation, task, action, and result. In order to keep it in line with nursing personal practice and the revalidation that we are now seeing, or that was introduced a couple of years ago, I would actually add an extra letter onto the end of that, and I would add an R onto that. So it would be situation, task, action, results, and reflection. Make sure you are familiar with that process. I do have another video that goes into that in great detail. So if you haven't watched that video, make sure you check that video out. I would also suggest using a second acronym. So as well as using STAR, STARR, I would also recommend using an acronym which is PPS, especially if you're applying for a 4-year undergraduate Master of Nursing degree program. If you just want to set yourself apart, PPS, I've actually mentioned this in one of my videos where I was talking about how to get a first in your nursing essay. And PPS basically stands for personal, political, professional, and social. Apply this to questions that ask you to look at the bigger picture, that ask you to conclude, that ask you to summarize. P is personal. What is your stance on it? Where does this come from? The next P is professional. What does the NMC say about it? What does the 5-year forward view say about it? What does the Francis report say about it? What is the 6 C's and how does that link to it? What influence does that have? The next P is political. What has the government said about it? What do the government currently do? Are there any legal guidelines in place that means that we do or don't have to do this? And then the final acronym, or the final letter in this acronym, is S. It is social. What does society say about it? What do your friends and family say about it? How are people acting? What do the media say? So make sure you're using STAR, STARR, and triple PS, particularly if you're applying for a 4-year or if you're interviewing for a 4-year undergraduate Master of Nursing degree, because that triple PS will literally just take your responses to another level. STAR is the basic, triple PS is literally the next level. The Maths and English test, I would actually compare the Maths and English test to GCSEs. So if you got anything from, I'd say, like a B or above, or like a 6 or above in your GCSEs, then you should be completely fine with the Maths and English part. I do have a lot of videos that go over drug calculations, so make sure you watch those because those are very helpful. Those are probably the highest ranking or the most viewed videos on my channel, so that just goes to show how helpful it is. However, I do want to say that in preparation for your maths test, make sure you are very familiar with your units, especially when it comes to weight and length, but more specifically weight. So you should be able to calculate, or you should be able to convert from anything from a nanogram all the way through to a ton, and convert down from a ton all the way through to a nanogram. So you have to be well versed with basic division, well versed with basic multiplication as well. And if you don't want to spend too long on the computer or on your calculator, then maybe having a better understanding of, I don't know, your powers would also be beneficial. So in terms of the English test, it wasn't really like your typical GCSE English test in terms of like grammar, in terms of like spelling. It's more like your methodology and how you plan and how you execute things. A very simple question that you might get during the English part of your test could be, you have a patient, he's 73 years old, he keeps having falls in the hospital, or yeah, he keeps having falls in hospital, what would you do? And basically what you need to do is go through a method of how you would, you know, in a sense, solve the problem or the potential problem or the actual problem of the patient having falls. And the first thing that comes to mind when I think of this sort of question is, I'm just giving you guys a whole bunch of acronyms. It's basically just ADPI. ADPI stands for, what does it stand for? It stands for assessment, it stands for, A is for assessment, D is for diagnosis, P is for plan, I is for implement, and E is for evaluate. So very quick, I don't have a video about this, but I think I might do a video about this, just going into it in more detail. A would be an assessment. What do you see? You've seen, just on a very basic level, what do you see? You've seen that this 73-year-old man, he's had 3 falls in the past 24 hours. Like that is actually really bad. But yeah, let's just say what you see, your assessment, this patient's had 3 falls in the past 24 hours. You talk to this patient says he's really wobbly, that he's really nervous, that because now he's been having a lot of falls, he's also in a lot of pain. What would he give his pain score out of 10? So that would be like a very basic assessment. Then D would be like the diagnosis. What is a problem? The actual problem is that the patient keeps falling. Or it could be a potential problem that, you know, the patient may fall in the future. So that's D, diagnosis, problem. P would be PI, would be to plan. So what are you going to do? You're going to try and prevent this patient from having falls, or you're trying to minimize the amount of falls that he's going to have. Or you're going to maybe say, if he does have a fall, let's kind of like minimize the impacts. But when it comes to falls, we want to have no falls at all. So that's what the plan is. So I is to implement. What are you going to implement? Maybe you're going to implement patients always having their call bells. So if they want to walk, then they're going to ring the call bell so you can go out to help them. Because that could be the reason why the guy keeps having falls. It could be because he doesn't know how to call for nursing help. It could be because he doesn't have the inappropriate shoes. So you would implement the patient having appropriate shoes or having appropriate footwear. That's implementation. The E would then be to evaluate. And in order to evaluate, you need to be able to measure. And in order to be able to measure, you need to have a starting point and you need to have an ending point. For example, I said earlier the patient had 3 falls in 24 hours. So after you've implemented, you know, after you've implemented your ideas or whatever it is you're going to implement, whether it's the patient having a call bell or all patients having appropriate socks, you're going to measure at the end again. Now you've seen that the patient hasn't had any falls in 24 hours. You can say that your plan your whole scheme of doing things has been successful. So that's basically what ADPI is. I think I am going to do another video that goes into ADPI in a lot more detail, because I feel like that wasn't the best example. But for those of you guys who are completely new to ADPI, I feel like that should be sufficient enough. But like I said, comment below, subscribe to my channel, so as soon as I do a video talking about ADPI, or like, I'd probably title the video like different acronyms to help you with your nursing interview, then yeah, you're notified as soon as that comes out. Yay, group interview. Oh, hallelujah. Now I can just sit back and relax. No, group interview isn't time for you to relax. You're not just competing against your best self, you're also competing against 4, 5, 6, 7, 8, 9, 10 other people. I do have so many different videos that give you guys really concentrated, dedicated, practical tips when it comes to a group interview, so make sure you check in the description box below. But I do want to say a handful of stuff in this video that I have written down. And one, in group interviews, make sure you get your point across. Don't just sit there and let other people talk. No. 2, make sure you listen, and don't just listen to reply quickly because you think, oh, if I reply really quickly they're going to see me. No, listen to understand. The next point is, don't be afraid to throw in questions to expand the group conversation, because a lot of group interviews do tend to be group conversations. And I don't mean play devil's advocate, like be able to back up your additional questioning. Don't just say, oh, but what if this and what if that, if you haven't already quickly explored it in your mind. The next point is to understand the difference between interrupting and interjecting, because you know, interrupting is basically stopping someone midway through their conversation or midway through their sentence, and then you having like a full-blown, you know, conversation or full-blown discussion. Interjecting is when someone could be saying, oh, and this point, you're like, yeah, that's a really good point, continue, yeah. That's interjection. Interjection is okay. Interruption in most situations is not okay. However, if you do find yourself in a situation where someone is just yapping, then sometimes you're going to have to cut them off. You're going to have to be like, mate, can you stop talking so I can talk, so other people can say some stuff. And next one is to have an open body language. Don't sit there with your arms crossed like that, because I feel like once you've got your arms crossed, you're not just saying to other people, oh, I'm not really open, I'm not really willing to talk. You're telling yourself, I'm not really open, I'm not willing to talk. Whereas if you have your hands down, or if you have your hands relaxed, other people will see, oh, she's willing to talk, she's willing, you know, to understand. You yourself would be thinking, oh, my arms are down, I'm ready to receive, I'm ready to give. You can't receive and give with your arms closed, but you can receive and give with your arms open. And in this simulation, what they basically want to see is how you interact with patients, how you interact with other members of staff. And this is where your experience or your lack of experience of working in a healthcare situation will come in. So I do think it's really important that you do have, you know, some sort of hospital-based work experience, whether it's like volunteering, handing out newspapers, or whether it's even working as a healthcare assistant. However, you don't need that, and I don't want to just keep like signposting you guys to other videos, but I'm gonna have to do that. I do have a lot of videos, for example, what to do when you start your shift, things that you should do, things that you shouldn't do. I have like a whole bunch of nursing chat videos, and yes, they're not exactly directed to, you know, passing your nursing interview. However, there are a lot of stuff that you can learn there that you can kind of encompass when you are in the situation of your nursing simulation. But just to give you guys real hard practical advice that you can actually do right here and right now, is when you're in the group simulation, a lot of it will tend to be like a problem or like an issue. Use the same acronym, use the ADPI acronym, assess what the problem is, diagnose it, implement it. ADPI, assess, diagnose, plan, implement and evaluate it. You're not just using that for the individual interview, you're also using that for the simulation. If all else fails and you're like, oh my gosh, there's a pretend patient in the bed, I have no idea what to do during a simulation, just think ADPI, ADPI, ADPI. Assess, what can you see? What is the patient telling you? 2, if you're in a simulation, you're like, oh my gosh, I don't know what to do, I don't know how to act, just pretend. Just go back to ADPI. A, assess. What can you see? You see a patient laying in bed. What is the patient telling you? 2, diagnose. What is the problem? What do you think the problem is? If the patient's like this, then they're probably in a lot of pain. If the patient's like, oh my gosh, nurse, my head hurts. Oh my gosh, my stomach hurts. That's the potential or the actual diagnosis. P, plan. What is the plan? The plan is to get rid of the patient's pain or to minimize the amount of pain that they're in. Implement. What are you going to do? You're going to give them some sort of pain relief, or you're going to ask them what's the most effective way. Some people, it isn't always pain relief. Maybe it's because maybe the pain is accentuated by the fact that they're really worried that their son's got exams and they're not sure if the son's going to pass or not. The relief for the pain could be giving them paracetamol, or it could be just talking with them and, you know, doing a whole bunch of non-pharmaceutical stuff in order to relieve their pain. I would be to implement it. Obviously, you're a student nurse or you're not a student nurse yet. You can't give them the pain relief, but you can say, you can verbally say, you know, I'm not a registered nurse, I cannot give medication. However, or I'm not a registered nurse, I can't do X, Y, and Z. However, I will go to the registered nurse and I will suggest, don't just say I'm going to go to a registered nurse and give it to her. You can say I will go to a registered nurse and I will suggest that she does this X, Y, and Z based on what I think and based on what the patient thinks as well. And then evaluate, come back to the patient. You know, you can even say 10 minutes later, ask the patient, has that been effective? Has this been effective? That's just a very basic example. I'm going to do a video where I talk about acronyms to help you during your nursing interview, because if all else fails, just go to the acronyms. Like literally, if all else fails, you can't rely on your own understanding. Just rely on acronyms. ADPI, triple PS, S-bar. Okay, S-bar might not be relevant, but the star with the additional R, just go back to the acronyms if you don't know what to do. ADPI is really going to help you during your simulation. Interact with the patient. Say, hello, my name is, you know, introduce yourself to the patient. So now let's briefly talk about the presentation. Depending on how many comments I may or may not get about presentations, I will do another video that goes into presentations into a lot more detail, because I know a lot of university programs are introducing presentations as part of their interview selection day. And in the presentation, what you can typically expect, just based on the emails that I've gotten from a lot of you guys who want tips and advice on how to navigate your presentation. Thank you guys so much, because your questions are also helping me to structure my videos so I can give other people who are in similar situations the most kind of practical information that I know how. So yeah, thank you guys for that, because a lot of you guys have sent me like guidelines and timetables for your nursing interview selection days and stuff. And what I will say is that during your nursing presentation, more than likely you'll get, oh my gosh, it's really dark outside and I'm just like, I can't really see the trees now. It's just all, yeah. But anyway, during your nursing interview presentation, more than likely you're going to get questions saying, pick a keyword. You're going to get like a list of 10 keywords and you've got to pick a keyword and say how that applies to your nursing practice. You may pick the keyword courage. You need to say what courage is, how it applies to your practice. Again, I would go back to the triple PS. Personal, what does it mean to you? Professionally, what does it mean to you? Politically, what does it mean? Or what does it mean not just to you, but to the topic in general? And socially, what does that mean? Also, obviously, in nursing practice in relation to what you are doing. This video was just a quick stop looking at different parts of your interview. We started off with maths and English test, individual interview, group interview, simulation, and presentation. If you found this video helpful, give it a thumbs up, subscribe to my channel, comment below for any questions, any video requests, any dilemmas. Thank you guys for watching this video. Be blessed, share this video, and I'll see you guys next time. Bye. Peace.